Hey, good afternoon, everyone, and welcome to today's event. My name is Nicole Hatzenbuhler, and I will be one of the presenters for today's webinar titled Conversations That Count, Empowering Nurses to Discuss Vaccines and Health Misinformation. I have been a registered nurse for 14 years and a nurse educator for 7.5 years. I'm currently an assistant professor of practice at NDSU Nursing at Sanford Health in Bismarck, and I specialize as a pediatric nurse educator. I also have the privilege of introducing my colleague and co-presenter, Dr. Sharon Nelson. I'll ask Sharon to say a quick hello so you can see her on the video.
Hi, everyone. Thanks for joining us.
Sharon has been a nurse for 40 years and has been in nursing education for over 15 years. She is currently an assistant professor of practice at NDSU Nursing at Sanford Health, where she teaches research and evidence-based practice and coordinates public health clinicals. We would like to thank you for taking the time to join us for today's session. If there is time, we will answer questions at the end of the webinar. If you have questions during the presentation, please type them into the Q&A feature of the Zoom platform. We have some disclosures before we begin the presentation. This nursing continuing professional development activity was approved by Montana Nurses Association and accredited approver with distinction by the American Nurses Credentialing Center's Commission on Accreditation. Criteria for successful completion of one contact hour includes attendance for the entire activity and completion of an evaluation form. This webinar is being recorded and will be made publicly accessible following the presentation. Contact hours can be earned through December 31st, 2025 through the recorded event. Please refer to the statement on the slide regarding the financial support that we received for this project. So we'd like to start today with a brief icebreaker activity to get to know a little bit about our audience. We ask that you select the link in the chat or scan the QR code on this slide using your personal device to bring up the Padlet board, which is a virtual bulletin board that will allow everyone to post. So to post your response to the board, you'll select the plus sign on the bottom of the page, and then you can type your answers into either the subject line or the text box. It doesn't matter which one. We would like to know how many years you've been in nursing and what your current role or employment setting is. And we'll give our audience a few minutes to respond to those questions. Okay, great, we're seeing some responses come up. Remember, if you haven't seen yours pop up on the board, you do have to select publish to get them to show on the Padlet board. This looks great. It really fun to see. We have a lot of years of experience on lots in public health, which is great. Both Sharon and I are very passionate about public health. Wonderful. Okay, well, great. Thank you for participating in that activity for us. It helps us to get to know a little bit about our audience and who we are talking to today. So this presentation was developed as part of a grant project that we got the opportunity to be involved with. We were part of a group of NDSU nursing faculty members that was asked to work with the NDSU Center for Immunization Research and Education, also known as CIRI. CIRI's purpose is to work collaboratively throughout the region to increase vaccination rates. And CIRI wanted to involve nursing in their work because of the access and close relationships that nurses have with patients and members within the community. So through our grant work, we conducted a survey, and we also did focus groups with different nurses from across the state to gain a better understanding of concerns and barriers related to vaccines among licensed nurses. These 3 agenda items that you can see on the screen were the primary workforce development needs that we identified during those focus groups, and that is the goal of our presentation today. We are hoping to help you learn to identify and address health misinformation, examine current evidence on vaccines, and explore evidence-based vaccine communication strategies. I think the really great thing about the strategies that we will share today is that their use isn't exclusive to vaccines. Vaccines were definitely the focus of our project, but identifying and addressing health information in our current world is incredibly relevant and will continue to be in the future. Also, the vaccine communication strategies that we will cover today can really be applied to any client who has questions or concerns about any type of treatment measure. Even if you have limited involvement with vaccines in your current place of employment, today's presentation should be applicable to your current role in nursing. At this time, I will turn the presentation over to Sharon.
Thank you, Nicole. So, as licensed nurses, we have a scope of practice, a code of ethics, we have ethical principles to follow, and we have ANA position statements. They guide and direct us in our practice. We have an obligation to our patients, families, and the community in which we work, and we are role models for shared clinical decision making. So, how do we support and help our patients in their decision making? As you know, we live in an era of information overload, and when it comes to our health, having credible information is very essential. Health information spreads on social media, online retail sites, search engines, and other ways. We can Google a health topic or symptoms such as abdominal pain, and several sites pop up. And as we read through them, we're bound to find all kinds of results, right? We have a pancreatitis, appendicitis, an aneurysm, maybe internal bleeding, or we need surgery or other treatments. We're finding all types of health information. Some individuals will use symptom checker sites or self-diagnose before they even see a physician. We may look at our online medical records or mobile apps, reading our test results or lab results, which I have done before I can visit with my physician. And then I Google, what does this all mean? And then I'm confused, upset, and anxious until I can visit with my provider. So we all Google and read and try to make sense of the information, and we continue to search for information. The National Center for Health Statistics, which is part of the CDC, stated that in 2022, almost 60% of adults used the internet in the past 12 months to look for health information. And women were more likely than men to look for health information and actually reach out to their provider online. So what do we believe? What health information is credible and what is health misinformation? The U.S. Department of Health and Human Services states that health misinformation is information that is false, inaccurate, or misleading according to the best available evidence at the time. And as nurses, we need the tools and knowledge to address health misinformation effectively. We want to ensure that our patients have the right information, and we want the right information and to have access to credible information as well, and we want it for our families. So, what types of health misinformation exist? Let's take a look at some of them. One is memes. They're colorful, eye-catching, they're images, they're ideas. Sometimes they're very amusing, they're effective, and they're shareable. They grab our attention. At MIT, neuroscientists found that the brain can actually identify images in less than 13 milliseconds, and the brain processes images 60,000 times faster than words or text. So images are very powerful, very effective. And so memes are really powerful, again, as self-expression. They're a tool for connection, and they're social influence. Health misinformation can also be on websites. They look professional. They might even look, and they're designed to look like news sites, but the stories are false or misleading. They're sensational headlines. They capture our attention. They make us want to click on them and out of curiosity, see what it's all about. The headlines trigger our emotions to enhance engagement. What's this about? It looks so interesting. It's distorted. It may be exaggerated. And how the words are framed actually in the headlines greatly influences how readers perceive the information. Health misinformation can be quotations, where information may be deleted or revised. Will help you age slower. I love that. This product is endorsed by doctors. And so without the full context, it's not a fair representation of what is said or what it is or what's being said. And then sources of health misinformation can be old images. They recirculate, they look credible. So look at this gentleman to the right, top right. So he's got a stethoscope. He looks a bit older. To me, he looks like he's experienced. He looks pretty serious. You know, he looks like a credible physician. And so again, pictures can really appear very credible. And yet, are they? Individuals, you know, he looks credible to me. So again, we look at those old images and wonder if they're true or not. And then sources of health misinformation can be videos as well that have been edited or changed. And then we have cherry pick statistics, right? Numbers that support what people want to argue or state, but without data and without context. And so they sound good, but the data has no reference or the research to support it. Or we have misleading graphs. As you notice, the arrow is going up. How long has it been increasing? Did it decrease? What was the baseline before the increase or decrease? So we're only seeing a snapshot of information and we're not seeing the whole story. So the dots are really not connected. So why is it so tempting to share health misinformation? We like to share information. I like to share information. I'll text my sister and say, can you believe this? Did you see this? And then she'll ask me questions about it. I'm like, I didn't read it. I just looked at it. And so again, multiple studies have found that negative information, novel or unexpected information attracts attention and is shared more often. Even if we don't know all the facts, we may share it. We share health misinformation because it may be new information. We want to protect people. We want to make sense of the information. We maybe know somebody that could benefit from it. New medications for dementia, new procedures, treatment for weight management, the benefits of specific workouts, or even potential cures for cancer. So if we're scared, we're also looking for that comforting information online. Again, not knowing if it's false or misleading. We want to feel connected to others. We may gravitate toward people who believe the same things. This feeling of connection is very powerful. So people that have been interviewed about their experiences of being in the hospital or in a disaster or having COVID, or maybe their infant had RSV or a cancer diagnosis, frequently mention the connection they feel with others with the same and similar experiences. Like flying in the airplane, right? Flying on an airplane, you're sitting next to someone and you strike up a conversation, and pretty soon you find out they're from your hometown or their grandparents are, or you went to the same vacation spot and you're instant friends. And also, I have sat by others that have told me about their cancer diagnosis. I've had cancer. So, again, we're sharing our experiences. Or I'm in the grocery store and I like to visit with people, and someone asks me about a product, and I'll say, you know, I would encourage you to visit with your physician. They're like, are you a nurse? And then I go, yes. And then they're like showing me all of their sores and all of their everything on their body. And then they also share with me their home remedies. So they may drink plum brandy because it helps their toothache or leg pain. And so again, they feel the connection, they trust you, and yet we're hearing some health misinformation. So why we have covered why people may share health misinformation, but how do people make healthcare decisions? One of them is emotions, right? We've had a good experience, a difficult one. We like our provider, we trust them. Maybe we've had side effects from treatment. So again, our feelings and emotions and personal experiences really drive our healthcare decisions. It's also how we process information. Is it easy? Is it complex? Is it scary? All of those drive our decisions. But emotions do have value. Without emotions to motivate us and push us, we might not go in to see a physician. Also, time. Time is a factor in healthcare decisions. So the research has shown that the longer someone takes to make a decision, that they might feel less confident in that decision. If unsure, they might not go to a provider or even bring up the questions that they have. And if we have to wait too long for appointments, several weeks or months to get in, we may just give up. Or when we finally get in, we may not even bring up the information we were concerned about. And then options, having too many options can be mentally draining, but also if we are limited in our options, so our physician, we just get a letter that he's out of our network. So now what do? Who do we visit with? Who do we trust? And so we may not go in at all. And this can be a barrier and impact our health. And then there's social norms. They are the behaviors, attitudes, the beliefs of a group or a community. They're often unwritten, but they're powerful tools for decision making. And they may be so ingrained in our brains and in our emotions that we do what we think is expected of us. And breaking social norms is really awkward or maybe uncomfortable. And then we have herd mentality. It's a social influence. The groups we belong to, the family, the circle of friends we have, we love, and we conform to that group, and we look to others for validation. Herd mentality can be positive or negative, depending on the beliefs or behaviors. Positive would be working collaboratively, collectively with a group to make a decision. Negative would be that we're observing the actions of others and assume they're based on accurate information, and we may follow suit, and there will be this domino effect, and such as panic buying, impulsive decision making. So during the COVID pandemic, people were buying toilet paper and Lysol wipes and hand sanitizer, and it created additional stress and challenges. And the last one I want to share with you is social determinants of health. Those are the factors that determine our health. They impact and really influence the healthcare decisions and outcomes. Where we live, work, spend time, the environment we live in, housing, our education, our access to healthcare, or we don't have access to healthcare, and also our literacy. There's many types of literacy. So health literacy, information literacy, civic literacy, a broader set of forces and systems are shaping us as well, our political, economic, social policies. So we all need access to trusted sources of health information to stay safe and healthy. So how can we determine what's true and credible health information? Well, we look for the expertise, right? Ask a credible healthcare provider, ask your doctor, and people will be asking you as a nurse to help them find credible information. We can also go on and look for established institutions. Established institutions conduct rigorous research. We could also check with the CDC, your local public health department, or public health agencies, and ask if there is information about a claim being made or about information that you're trying to find. We could also look for peer-reviewed journals and databases such as CINAHL. So CINAHL is a nursing and allied health literature database. I use it with my nursing students. It's easy to navigate. You could also review clinical studies, research, and scientific journals. And then beware of commercial sites. If a site is trying to sell something, they have a financial stake, right? They want you to believe what they're selling. And so their profit is tied to the information that they're trying to convince you about. So type the claim into a search engine to see if it's been verified by a credible source. And then we need to understand and identify bias. There's many types of bias, and the most common one on the internet is called confirmation bias, where it's the tendency to really favor the information that supports one's prior beliefs, values, and judgment. So for me, it's really important to be aware and understand my own bias, and does it help me or is it a barrier for me? And then consider the look and feel of a website. Check the links. Credible websites will often link to credible and established institutions. So beware if you're linking to a random website. Of course, if you're not sure, don't share it. And then check the dates. Data evolves as scientists learn more and as research advances. So if the information is old, it's a signal that the website also does not have the most current information. So as nurses, our strengths and expertise are in our critical thinking and reasoning, our clinical judgment and decision making, and providing needed education. A helpful resource is has a checklist. So every time that you're checking and looking for health information and you want to evaluate it, the Office of the U.S. Surgeon General has a checklist to go through to evaluate that information, and it'll be available for you at the end with some of our resources we're going to share. So I'm going to turn the presentation over to Nicole.
Thanks, Sharon. So as Sharon just mentioned, the Office of the U.S. Surgeon General provides some guidance for how we should talk to friends and family about health misinformation. One of the best ways to change someone's mind about misinformation is simply to listen to them. Try to understand their fears and why they believe what they do. We don't want to focus on that false claim, but rather just focus on that broader issue and how that individual feels about it. We want to empathize with them to establish trust and respect, ask questions, understand where they're coming from, and really get an idea of why they believe what they do. Another helpful thing we can do is to guide people to credible sources of information. Oftentimes, we need to remind people that an expert on one topic might not be the best expert to turn to on another topic. It's also so important to avoid publicly shaming people. No one likes to appear wrong. I know I don't. So when possible, try to have conversations one-on-one, either face-to-face or via a direct message. Having conversations in the comments under a social media post has the potential to backfire, and we see that happen a lot because there's no tone of voice or context to that conversation. We actually might spread misinformation further if we're having those back and forth exchanges on social media. And then when possible, use inclusive language that makes it clear that we are also impacted in that same way as the person that we are talking to. So when specifically responding to a statement or comment that is misinformation, we have to choose words carefully because our feelings of familiarity and truth are often linked. We are more likely to believe things that we have heard many times than we are to believe new information. This is a phenomenon called the elucidatory truth effect. And because of this effect that we are all susceptible to, repeating misinformation can actually strengthen the belief in that misinformation. We want to avoid doing that when what we're trying to do is address misinformation. So the fact warning fallacy fact method is what is recommended in the debunking handbook, which is a great resource that we'll share at the end. When responding to misinformation, we want to start with the truth. State the truth simply and clearly. Try not to lead in with a rebuttal, which is probably what we naturally want to do. Then we should follow with a warning that misinformation is coming. This is what is referred to as pre-bunking. We want to make it very clear that what we are stating is misinformation. We also only want to repeat misinformation one time because repeating it can strengthen the belief in that falsehood. Step 3 is fallacy, where we should explain that the misinformation is wrong and try to help people see the motives that a particular individual might have in that situation, why they're sharing that information that's not correct. Then we want to finish with repeating the truth or fact. We want that alternate correct information to fill in the mental gap, and we want it to be repeated so that familiarity can help us establish that as the correct truth. So let's look at an example of how to use some of these strategies we just covered to address a real-life example of health misinformation that was spread on social media this spring. So in March, a Daily Mail article headlined "Sunbathing for just one day may increase your risk of heart disease" was published. This article referenced a study from the University of Louisville in Kentucky. Preliminary research from this study was presented at the American Heart Association conference, and that study found that short-term high heat exposure could increase inflammation, which could accelerate cardiovascular disease. So an individual posted a response to this article on social media claiming that the study wasn't what it seemed. That individual made this comment: "The reason they're trying to sit here and say everything causes heart attacks is because they're trying to cover up the side effects of the vax." And this individual was referring to side effects of the COVID vaccine. So this study actually involved participants that were recruited in 2018 and early 2019 before the COVID-19 pandemic even began. So it's completely unrelated to the results of this study. We are going to use the fact warning fallacy fact method to develop a response that could be used to debunk this myth when discussing it with patients, family members, and maybe even this individual. Remember, we always want to start by being empathetic, inclusive, and respectful. And we might say, "I can understand why you would be concerned after reading that. There's so much information out there and it's really hard to know what's true." Then we want to lead with the fact, provide that factual alternative that explains what really happened if the misinformation is corrected. And for that, we might say, "Clinical trials and ongoing monitoring have shown that COVID vaccines are safe and effective for most people. Any side effects are mild and temporary, and serious side effects are rare and will be investigated by health authorities." Then we want to warn that the myth is coming, and repeat that misinformation only one time directly prior to the correction. So we might say, "A myth that was spread on social media claimed that a research study that found an increased risk for heart disease from sun exposure was actually being used as a cover-up for side effects of the COVID vaccine." And then we want to go to step 3, which is fallacy, which is point out those logical fallacies underlying the misinformation. And we might say in this scenario, "The subjects in this study about sun exposure were actually recruited before the pandemic even began and before COVID vaccines were developed. That claim has no concrete evidence. Unfortunately, some people will make claims like this to spread fear, and that ultimately harms public health efforts. Then we want to finish by reinforcing the fact. We want to repeat the fact multiple times if possible. Remember, familiarity is more important than truth. So repeating the facts and truth often make them as familiar as possible. And for that, we might say the truth is that COVID vaccines are continuously monitored to ensure safety and efficacy. And when side effects are identified, they are reported and addressed. So we have a polling question for you now. We want to get an idea of what health-related misinformation you are hearing from patients, friends, and family members. We're going to activate the poll in Zoom, and it should pop right up on your screen. The question is select all that apply so you can choose more than one option. And we have it launched and ready for you. More responses coming in. We'll wait just a couple of seconds. All right, so I can share the results with you on the screen. So it looks like primarily we're hearing about government and political cover-ups and vaccine myths, not surprising at all. It's kind of what I expected doing this poll. So thank you for sharing that with us. So that will help us transition to the second part of our presentation, which is discussing one of the most common types of health misinformation, which is vaccine misinformation, which you're hearing as well. Misinformation about vaccines is a major contributor to vaccine hesitancy. Vaccine hesitancy is not a new thing. There is a long history of vaccine hesitancy since vaccines were first developed. Oftentimes we see that hesitancy is rooted in fear, and that fear is based on misinformation. The spread of misinformation is very easy in the digital era that we currently live in, and we are definitely seeing the impact of that on vaccination rates at the state and national levels. So we're going to look at measles as an example of the impact vaccine hesitancy has on public health. Measles has seen a 30% increase in cases globally, and we are currently seeing that impact in the US. As of September 12th of this year, the US has had 251 cases of measles, and there have been 13 outbreaks. In 87% of the cases, the individual affected was not vaccinated or their vaccination status was not known. North Dakota has not had a case yet, but 2 neighboring states have. South Dakota had 1 case in Rapid City in July, and Minnesota is up to 49 cases at this point. These are screenshots of online news articles about those outbreaks. The bottom one was published in the Fargo-Moorhead Forum in August, and so you can see it was 34 cases at that time, and now we're really close to 50. We need a 95% coverage rate for the MMR vaccine to provide herd immunity. If we look at North Dakota's current rate among kindergartners, it's 91.22%. In some select elementary schools across the state, that rate is 80% and even lower. It is very possible that North Dakota experienced some measles outbreaks this year because we're seeing it in states that are very close to us, and we do not have the vaccination rates there to protect. These are some other visuals to illustrate the impact vaccine hesitancy is having on immunization rates. This was pulled from CDC VaxView, and it's the national percentage of kindergartners with an exemption for at least 1 vaccine. The most current data they had available was 2022 to 2023, so that's why it only goes up to that time frame. You can see the green line on the bottom is medical exemptions. Those have remained relatively constant. Our blue line is any exemption, and the purple line is non-medical exemptions. We can definitely see those rates climbing since the COVID pandemic. This visual from VaxView is looking at the percentage of kindergartners specifically in North Dakota with an exemption from at least 1 vaccine. So again, the green line is medical exemptions. Those are still really consistent, but our blue line for any exemptions and purple line for non-medical exemptions is really climbing. I think you can tell from this graph that North Dakota has one of the most relaxed childcare and school immunization policies in the US. North Dakota allows medical, religious, and philosophical exemptions. There are only 15 states that still allow philosophical exemptions. Many of the other states require a notary signature or education from a healthcare provider to claim that exemption. North Dakota doesn't. Parents simply just have to sign a form. So vaccine hesitancy is clearly an issue and it's impacting public health. So what can nursing do? What is our role in this issue? We have a very important responsibility. Nurses can remind patients and families of the power vaccines to have and help protect. We can educate those individuals about the risks and benefits of vaccines, and we need to communicate clearly and effectively about vaccines. So this is a reminder for any of you that may be questioning your ability to make an impact on a client's healthcare decision because you're just a nurse, right? Every year, Americans rate 23 professions in Gallup's Honesty and Ethics poll, and nurses have been at the top of that list for 22 consecutive years. That's pretty amazing. Patients, families, community members trust nurses. They value our opinion. Our recommendation does matter. It's interesting to note that the ratings of nearly all the professions that were measured in 2023 were actually lower than they have been in recent years in this poll. Nurses were still the most trusted profession, but our rating was down several percentage points from past years. I think that's a good reminder that we have a really good opportunity to rebuild public trust, not only in vaccines, but also in healthcare and healthcare professionals. We can do that by how we communicate with people about controversial subjects like vaccines. So when reminding patients about the power vaccines have to help protect, we need to emphasize that vaccine preventable diseases still exist. We are still seeing outbreaks of these diseases like the measles, and infections from these diseases can be serious and life-threatening. Vaccine coverage needs to be high to protect vulnerable populations, and that includes the children and those with underlying medical conditions within our communities. This is a great visual example of vaccines' power to protect. We know vaccines are effective because the number of cases of diseases has decreased exponentially. This is a visual of the number of cases in the 1900s, and this is the number of cases that we're seeing in the year 2019. So even though historically we are seeing a decrease in cases, the majority of these diseases have not disappeared, which is why vaccines are still important and necessary for public health. The HPV vaccine is another great example that illustrates vaccines' power to help protect. The HPV vaccine has been available since 2006. Historically, there is a lot of hesitancy with this vaccine because it's given to young children for a sexually transmitted infection. The HPV vaccine is recommended for 11 to 12-year-olds, but it can be given as early as age 9. And that is very, very difficult for parents to talk about and to make that decision. However, the data that we have available on this vaccine shows us that it is incredibly effective. In a recent study, there were no cases of cervical cancer documented in women who received the vaccine between 12 and 13 years of age. So it's been said that vaccines are victims of their own success. Vaccines are so effective that many parents and many younger nurses and healthcare providers have actually never seen a case of the disease that the vaccine protects against. That can make the perceived risk for a parent quite low when they're considering whether they should give their child this vaccine or not, and that's completely understandable. As nurses, we need to help people understand the risks and benefits so they have that accurate conception of those risks and benefits. So vaccine safety is a common concern that patients and parents have. Safety is the main focus of the vaccine development and approval process, and that process can take years. It includes clinical trials that measure safety among thousands of volunteers. The FDA will issue a license only if the vaccine is safe and effective and its benefits outweigh the risks. The CDC will then issue a recommendation for how that vaccine should be routinely administered. And that recommendation is based on the collective opinion of a group of medical and public health experts. After vaccines are licensed and made available to the public, they are continuously monitored for side effects through a series of safety systems. These safety systems are actually the reason that a pause was put on the Johnson & Johnson COVID vaccine in 2021, because those systems identified the risk for blood clots as a side effect of that vaccine. A safety concern identified about a vaccine, although not ideal, means that these safety systems work. They are doing what they are supposed to do, which is ensuring the continued safety of that vaccine for the general public. Some people are concerned about vaccines because of the risk of side effects, and that is a risk, absolutely. However, there are risks associated with everything in life. Choosing not to vaccinate doesn't mean eliminating risk. It just means trading that small risk of a serious side effect from a vaccine for the greater risk of complications from a vaccine preventable disease. Another concern that patients and parents may have is adverse events, which would be a serious event after a vaccine, like the development of a blood clot or a seizure. People may think that all adverse events following a vaccine are caused by the vaccine, but that's not true. Just because one thing follows another does not mean that the first thing caused another. For example, if a patient has a heart attack a week after they receive a vaccine, that doesn't necessarily mean that the vaccine caused the heart attack. On any given day in the US, someone has a heart attack every 40 seconds. Research would need to be conducted comparing two groups, those who received the vaccine and those who did not, to determine whether the vaccine had any potential role in the heart attack or if the timing is coincidental. A single case report isn't enough for us to make that causal association, but many parents and patients do not understand that. We have to help them understand that. An allergic reaction is another potential adverse event associated with vaccination, but the risk of that is also very low. For every million vaccine doses, only 1 to 2 people will have a serious allergic reaction. That is about 0.0002% of all vaccines given. That means that a child is more likely to be an Olympic athlete than they are to have an allergic reaction to a vaccine. So as Sharon previously mentioned, many healthcare decisions are emotional and influenced by thoughts and feelings. Logic and facts are not always the primary factors behind decision making. The most common assumption that we might have about somebody who is vaccine hesitant is that they just don't have an understanding. They don't have enough information. They just need more education. However, we know from research that's not true. Communicating scientific facts alone is unlikely to improve confidence in vaccines. Providing more information might actually backfire and cause individuals to be more resistant to that recommendation. So if communicating scientific facts isn't working to improve vaccine confidence, we need to change how we are communicating about vaccines. We need to transition from focusing on what, which is the safety, the ingredients, facts about diseases, to how to communicate. So this shift doesn't mean that we aren't talking about the what. Oftentimes, patients will have a concern about safety or an ingredient that we do need to address. What we need to focus on is changing our approach to communicating that information in a way that people are receptive. So let's start with what not to do. The writing reflex. We are nurses. We want to be helpful, right? We think we have the knowledge and information and we have the solution and we should just share that with people and they're going to make a good choice. Well, that almost never works. When we tell people what to do, oftentimes they do the exact opposite because they want to be autonomous. Nobody wants to be told what to do. I don't want to be told what to do either. So I completely understand that. So we have to rein in that instinct and not correct their behavior. Don't tell them what to do. It's not working. What we should do is deliver a strong recommendation using presumptive language. The use of presumptive language has been shown to be an effective way to increase vaccination uptake. The presumptive format frames the conversation by assuming that that individual will choose vaccination. So instead of asking, how do you feel about doing shots today? Do you want to do shots? Is that something we're interested in? We frame it like this. We have some shots to do today, or your child is due for some vaccines. We're going to get those ready. There is strong evidence supporting the use of this approach in the literature. In one study conducted by Opal and colleagues, the analysis showed that parents hearing presumptive language were 17.5 times more likely to accept vaccines recommended for their infant than parents who were hearing that participatory language. The presumptive format works because it makes vaccination the clear standard of care. This is just what we do. This is what all kids at this age are recommended to get, and this is what they should get. This is what we do for all adults coming into the clinic. It normalizes that vaccine decision. It almost makes it seem like it's not a decision. Using that presumptive format can actually make individuals more comfortable and confident in the decision to vaccinate because it is coming from a trusted healthcare professional. You as the professional are confident in this decision, and then they can be confident too. This format still provides an opportunity to address questions and concerns. We are never going to force somebody to get a vaccine that really doesn't want it, right? And we want people to ask questions so they can get a better understanding, so it still provides that opportunity for dialogue. So here are some tips for using presumptive language effectively. Tone and body language matter. Do not make the presumptive format sound like a question. It's not a question. This is a recommendation that we have. We want to make eye contact. We want to be very attentive, avoid distractions. Try not to have these conversations with our back to the patient while we're charting on the computer. This is an important conversation and we should treat it that way. We want to use presumption even if that individual has been hesitant, even if they are what we would call anti-vax, even if we know that they are not going to accept that recommendation, we should still lead with that. And then we need to allow time for people to respond. Let them think this through when we start with that presumptive language. If we hear silence or they're not responding, don't quickly assume that that means that they're not going to choose the vaccination. Give them some time to process. So if that strong recommendation and presumptive language is not successful and patients or families are still hesitant, we might need to shift to some additional communication strategies. So one communication strategy that we've chosen to focus on for today's session is motivational interviewing. And I'm going to turn this over to Sharon now to give us a little introduction to motivational interviewing.
Thank you, Nicole. So there are a variety of motivational interviewing, or MI, as I will call it, communication styles, strategies, and approaches to use. Nicole and I have participated in MI education, and you don't have to be an expert or have extensive training to use it. You can use components of MI. You don't have to spend a lot of time having long conversations with patients about it, and it's very effective. Some of you may be already using MI approaches, and others, as you're engaging with your clients, you're using some of those approaches too. So motivational interviewing is an evidence-based communication approach. The spirit of it entails a collaborative partnership between patients and nurses. It's really dancing and not wrestling. MI is working with the client rather than at the client. MI is a guiding style of communication. It's a dance of a different pace in the conversation. So it's a give and take, a back and forth. We guide with open-ended questions that are broad, inviting, and engaging. So we're not just getting those yes, no answers. We want to gain more insight and information from the client. And we follow using reflective listening. So we're listening and reflecting back to what we're hearing. The client is the expert, and we need to explore what's important to the client. And if we're really listening, the client will let us know how to shift the questions. So MI is a dance of a different pace. It's not directing, confronting, or judging, even though we indeed have the expertise, the experience, the most current information. We have the client's best interests. We do not tell them what to do. Motivational interviewing is really to engage and strengthen their personal motivation, bring their wisdom to mind. They already know their bodies best, or their family members know their bodies. So it empowers a client to look at their priorities, their needs, and increase their capacity to reach a goal or change. So with MI, it really takes self-awareness, acceptance, affirmations. It takes curiosity. It takes really being present and listening and understanding what the client is saying. So motivational interviewing has, again, many approaches, and we're going to show you the 4A's method. It's an evidence-based communication approach. It's ask, acknowledge, affirm, and answer. And we'll go through these really quickly. So we're going to ask. We're going to encourage the patient to share their concerns. We're going to use open-ended questions. We want to hear the client's perspective. We don't want just a yes/no answer. So how are you feeling about your health today? What concerns you most about your heart condition? What questions can I help you with? Very inviting, very engaging. You're letting the client decide what's important to share, and the question deepens our understanding. We're hearing their story, and we may hear if there are any barriers at all. Next, we're going to acknowledge. Recognize the person already has knowledge. So again, they know their bodies. Thank you for taking the time to come in today. It's clear you've looked into what's happening with your blood sugar levels, or you have already done so well at managing your diabetes. So we're empowering them by acknowledging their capability, and we're also strengthening their motivation. So we're learning their story. Next, we're going to affirm. Affirm that it's okay to have questions. You have some valid concerns. That's a great question. I've had similar questions or concerns. There is so much information, it can be overwhelming. So you're understanding the client, you're not judging, you're not making assumptions. And finally, we're going to answer, but we're only going to answer if we have permission. We need permission to share information or facts. So again, education is powerful, but we need permission. So may I share with you some information that I've learned, or can I share with you a few credible resources that I found helpful? And if the answer is no, then you just roll with resistance and try again at the next visit. So to summarize, MI is that nurses can explore patients' understanding. We can identify any barriers. We can actually look at their autonomy and their strengths and strengthen them. And we can look at their personal responsibility and reserve our judgment. So I'm going to turn it back over to Nicole.
Thanks, Sharon. So we put together some case studies to give you some examples of how these strategies can be used with patients and families. So our first case is a 9-week-old infant who is coming into a well child visit, and that infant is due for the 2-month immunizations, and there's a lot of them. You can see them on the slide there. So remember, we want to start that conversation with a strong recommendation using the presumptive approach. We might say, your baby is due for 2-month immunizations today, so we can get those ready. So then with this particular caregiver, they're a little concerned, worried that there's too many vaccines for their child that is so young, and worried that the immune system of that child is not going to be able to handle all of those vaccines at once. So we met with resistance, so we want to shift into that motivational interviewing approach and start with the 4 A's. So ask an open-ended question, tell me more about the concern you have about the vaccines. This caregiver responds that they've read on social media and heard from friends that too many vaccines will overwhelm the infant's immune system. Then we want to acknowledge the information that individual is sharing with us and the expertise they have in this situation. We could say, given the information you've received, it makes perfect sense that you would be concerned. It's really good that you're asking questions and trying to do what's best for your child. We also want to affirm and validate that individual. Really, these first 3 A's are all about establishing trust, validating that person's concern because their concerns are valid. We might say it's okay to have questions about vaccines. Many parents have questions about these 2-month vaccines because there are so many of them. So then before we give the answer, we need permission to share. Many of us, we're building up, right? We have so much good information to share, but always ask for permission first. Asking permission gives the patient or family member the power to make that decision. It also lowers their resistance because they are choosing to listen to what we have to say. So we might say, I have some information about these vaccines that might be useful. Can I share that with you? Then when we provide an answer, we want to do it in a simple way that teaches them how the vaccine works. We don't want to just tell them that the vaccine is safe and effective. They've already heard that. They have concerns, and so we need to go a little bit deeper. We want the answers to be simple, and we want to stay directly on the topic of their concern. In this scenario, we might respond by saying, babies' immune systems are exposed to antigens really anytime they do anything. The exposure they get from their environment is much more than the exposure they get from vaccines. Science and technology have advanced, so kids are actually getting fewer total antigens in all the vaccines that they get today when compared to vaccines that were given years ago. And then we always want to end that education piece by getting some feedback from that individual. So asking, what are your thoughts about that, or how are you feeling? Remember, this is not a lecture. We are not wrestling anybody. It's a back and forth. And so we want to give them the opportunity to respond so we can continue that conversation. All right, our second case, this is an adult client for you, a 53-year-old male with hypertension who is diagnosed with hyperlipidemia coming into the clinic. And this client has not yet received a flu vaccine for the current season. So let's take a look at how those communication strategies might be used with this client. Again, we want to start with that strong recommendation using presumptive language. We might say, I see you haven't gotten a flu vaccine yet this year. Let's get you vaccinated today. This particular client responds with hesitancy, says they're not getting the flu vaccine. They got it before, it made them sick. They don't want to repeat that experience. So then we shift into our 4 A's by asking with an open-ended question. We might say, tell me more about what happened when you got the flu vaccine. This client says that they got a low-grade fever, headache, body aches after the vaccine. Symptoms were brief, but then resolved, and the client thinks that he got influenza from the flu shot. So then we want to acknowledge that individual's information that they've shared with us, what they know about this already. We might say, I've heard that same concern about the flu vaccine from others. You're not the only one with this type of experience. Then we want to affirm them. It's okay to have questions. It's okay to think through these. It's great that you're thinking carefully about your health decisions. I think that shows that you really care about yourself and you want to make good choices. Okay, before we give them an answer, we ask for permission. Remember that if they say no, they don't want to hear what we have to say, that's okay. We can just move on, respect their autonomy. Most people are going to be open to hearing what we have to say just because we asked. And so we might say, it sounds like you're worried about the flu vaccine. Is that correct? I've learned quite a bit about this vaccine because we give it a lot here at the clinic. Is it okay if I share some of information with you about that vaccine? And then our answer in simple language, teaching that individual how the vaccine works and addressing their concern might sound like this. The flu vaccine is made of a very small piece of the dead virus, and that cannot make you sick. The side effects that you had are all normal side effects that we expect after a shot as your immune system responds and prepares to fight off that flu virus if you are exposed to it. Then what stands out to you about the information I shared, or what do you think about that information that I've just shared? Remember, always turning it back to the client so you can continue that conversation. We also wanted to share a different example other than a vaccine related situation to give you an idea of how motivational interviewing strategies like the 4As can be used in other contexts with patients and families. They're very versatile. In this case, we have a 63-year-old female who is admitted to the med-surg unit with severe hyperglycemia. She has type 2 diabetes. She was started on subcutaneous insulin 2 years ago. Based on her repeated hospitalizations and inconsistent reports in the history, we're not really sure she's being compliant with her medications. So we don't have a presumptive approach for this one, right? Because it's not a vaccine conversation. So we'll go right into the 4As with that open-ended question. I'd like to talk about your diabetes medications. What's it been like having to do injections every day? This client tells us that they don't like their injections. They're painful. The client also reports that she will sometimes skip an injection if her blood sugar isn't too high that day. Then we want to acknowledge that client. Well, that's understandable. I haven't taken care of a patient yet who enjoys getting shots every day. Tell me more about how you decide whether or not you are going to give yourself insulin that day. So then this client shares that they are checking their blood glucose in the morning. If the number is under 200 and they're feeling good, they will skip insulin that day. The client also says that they are very consistent taking their oral medications. So again, we want to affirm them, validate what they are doing well. We might say, I'm glad to hear that you've been so good about checking your blood sugars and taking your oral medication. It's clear that you care about your health and you are trying to figure out the best way to manage your diabetes. Then we want to ask permission before we give that answer, before we give that education. Would it be all right if I shared some information with you about insulin and diabetes? And then our answer in very simple terms for this scenario might be this. Insulin helps keep blood sugar levels within a normal range, and that can prevent long-term complications. Some people feel okay even when their blood sugar is high, but that's still causing damage. Insulin is also typically more effective than metformin for lowering those glucose levels. Then asking the client for feedback. What do you think? How does that information fit with what you were thinking about your diabetes management? So we hope those were helpful for you. These definitely don't come naturally. It's not a natural way for us to communicate, and it does require some practice. So now we've given you some examples, and we'd like to hear from you. We're going to use that same virtual Padlet board as before. You can either copy and paste the link that was just shared in the chat, or you can scan the QR code on your phone. And when you post your response, we'd like to hear about a situation in your place of work where you might use one of the communication strategies that we covered today, whether that's addressing misinformation, or using that presumptive language, or using the 4As or motivational interviewing strategies. So we'll give just a few minutes for those answers to pop up on our screen. Oh, that's a great one. Residents in the nursing home. Awesome. Yep. So glad. Thank you for sharing that. Oh, medications. Yep. With an off-label use. Excellent. Yep. That's a great way. HPV vaccine hesitancy. Yes. Outreach events. Oh, I like that. Somebody mentioned being like proactive and compliant with screenings and how helpful they are. Absolutely. Patients not wanting multiple pokes. Oh, that's great. Tobacco and nicotine dependence treatment. Yep, absolutely. Motivational interviewing is really great for those. Yes, and working in rural healthcare. Wonderful. Sharon and I think these strategies are so great. We work primarily with our students, and we always say this motivational interviewing is so great for our students, like how wonderful, and we use some of the strategies already. So glad to hear that you are finding these useful. We think they're very useful too, and we hope that you take them with you today and continue using them to give really good care to your patients, because we know you're doing that. So Now I think we have a few minutes for questions. I'll ask Sharon. Sharon's been monitoring the Q&A for us. Are there any questions that have been posted, Sharon, that we could address in the last few minutes that we have of this webinar?
We don't have any yet, but we're looking forward to hearing some.
Yeah, no questions yet. And you can also type them into the chat if you prefer. We can maybe take a peek at that because sometimes people put questions in the chat for us. Oh, someone has a great question in the chat about the valuation link. It will be posted shortly. Great.
Yes, it is posted now.
Okay, great. Thanks so much, Sharon. Okay, so seeing no questions, we will just wrap up. We do have some information that we would like to share with you before we get to the conclusion. So here are some additional opportunities for education and training. Siri has a virtual motivational interviewing training, which is great. Both Sharon and I have completed that training. Siri also has some wonderful educational opportunities that they offer often throughout the year. We strongly encourage you to join their mailing list, which is listed on the slide. You can also watch recordings of many of their previous sessions on their YouTube page. This bottom link is the Becoming Trusted Messengers training, and that's a virtual training on the 4A's method that we covered today. When we distribute the certificates for contact hours, we will also include a link for you to access the recording of this presentation if you want to refer back to it, or you can share it with others. Please share it, because remember, those contact hours can be earned for the recorded event as well. In that email, you will also receive a handout with a list of resources that we've mentioned throughout the presentation. You will also receive the links to these training opportunities, so we'll have it all there for you. All right, we want to thank you for attending today's webinar. Contact information for both myself and Sharon is listed on this slide. Please connect with us if you have questions, if you would like help developing educational material for your department, or if you are interested in an in-person training session. We would be happy to help in any way that we can. Remember to complete the evaluation form if you would like to earn 1 free contact hour for this session. You can do so by scanning the QR code on the slide. Thank you again for your time today, and we hope you have a wonderful rest of the afternoon.
Thank you. Take care.